Hi there, I'm Karine Tawagi, and I'm going to be talking today about bladder cancer, basics, treatment, risk factors. I'm a genitourinary medical oncologist at the University of Illinois in Chicago, and welcome to this presentation. So we're going to cover a couple things. First is, how is bladder cancer diagnosed? What are the stages of bladder cancer to understand when you're talking to your care team? And what types of treatment exist, as well as finish up with what are clinical trials. So first off, with some basics, the urinary system. So the bladder is where urine is made that drains from the kidneys into the ureters, which are the two tubes that you see here on the left that drain into the bladder. And then the urethra is the final tube through which the urine drains. And bladder cancer often starts in the bladder lining. So when I explain it to patients, I explain to them, think of the bladder as a balloon and it has multiple layers. And depending on where the cancer how deep the cancer goes from the inside of the bladder to the outside, that can help determine what the stage and what the treatment options are going to be. So some risk factors for bladder cancer: smoking is a well-established risk factor. There are associations with some workplace exposures. Certain industrial chemicals have been linked to bladder cancer. Older age, it's more common in males. Some factors like chronic bladder irritation and infections can lead to a specific type of bladder cancer, and then bladder birth defect can also increase the risks of certain types of bladder cancer. In terms of symptoms of bladder cancer, blood in the urine should alert someone to talk to their doctor, and sometimes it can be things like a urinary tract infection, but if it's persistent or new, it's always worthwhile talking to your doctor about blood in the urine. Changes in bladder habits or symptoms of irritation, so burning when you pee, peeing a lot, those are all reasons to talk to your doctor about potential doing some further tests. And then advanced bladder cancer can present with other symptoms such as back pain, being unable to urinate, weight loss, feeling weak, tired, or bone pain. In terms of bladder cancer diagnosis, it starts with the urologist. So the urologist will look into the bladder with a camera. This is called a cystoscope, which you can see here on the left. And they insert a tube into the bladder to look inside. And on the right side, you can see this is what it looks like from their end on the camera. And they're essentially looking from that lining of the bladder. Is there anything abnormal there that could be suspicious for bladder cancer? And then a urologist may refer a patient with suspected bladder cancer on to a medical oncologist like myself in specific scenarios. So if you have high-risk bladder cancer, so that is when it invades from that inner layer to the middle layer, which is the muscle, and that's higher risk when it invades into the muscle, or if the cancer spreads to other places like nearby lymph nodes or other organs, it's also considered more advanced, and it will require for a patient to see a medical oncologist like myself. So in terms of knowing, is the cancer muscle invasive or high risk? Sometimes on CT scans and things like that, you can see if the bladder cancer is invading into the muscle or beyond. But sometimes, when they look into the bladder, they see that superficial tumor, they take a biopsy, and that biopsy is called transurethral resection of the bladder tumor, also known as TURBT. And basically, they're scraping that tumor, and then they're trying to see, if you look at the bottom here at the 3 layers, they're trying to see, if you think of that balloon with 3 layers, is the bladder cancer infiltrating into that middle layer or beyond, which makes it muscle invasive, the muscle being that middle layer, and then the cancer is considered high risk. So the pathologist examines it under a microscope from that biopsy that the urologist takes, and they'll determine if it's invading into the muscle layer by looking at the slides from that biopsy.